measure ankle swelling, the subject should be seated in a long sit position on the treatment table with their ankle and distal 1/3 of their lower leg off the base of the table. The ankle should be in a relaxed and slight plantar flex position. With a washable marker, you will need to mark several anatomical landmarks to help with the measurements. On the medial side, you'll mark the navicular tuberosity and the distal tip of the medial malleolus. And on the lateral side, you'll mark the base of the fifth metatarsal and the distal tip of the lateral malleolus. On the anterior side, you'll mark the tibialis anterior tendon. You will use the figure 8 method. You will begin by placing the beginning of the tape halfway between the tibialis anterior tendon and the lateral malleolus. The tape is drawn medially across the dorsal aspect of the foot over the tarsal bones and placed just distal to the navicular tuberosity. Tape is then pulled across the arch of the foot and up just proximal to the base of the fifth metatarsal. Tape then crosses the tibialis anterior tendon and is continued around the ankle joint, just distal to the distal tip of the medial malleolus. Tape is then pulled around, crossing the Achilles tendon, and finally, tape is placed just distal to the distal tip of the lateral malleolus. The measurement is ended at the starting point of the tape. To measure knee swelling, the subject needs to be in a supine position. Several anatomical landmarks need to be marked, and these include the tibial tuberosity, lateral and medial joint line, superior border of the patella, and 2 inches proximal from the superior aspect of the patella. The circumference measurements are taken at these 4 landmarks with a standard tape, and you will measure it in the metric system using the centimeters. Please remember that each measurement needs to be repeated 3 times for accuracy. To measure ankle dorsiflexion and plantar flexion, the subject should be sitting with the lower leg and knee hanging down from the treatment table and with the ankle at 90 degrees. The tester will stabilize the tibia and the fibula distally. The axis is inferior to the lateral malleolus. The stationary arm is parallel to the fibula, and the movable arm is lined up with the fifth metatarsal. The subject is asked to dorsiflex their ankle actively. At that point, you record the degrees of range of motion. The tester will then passively dorsiflex the ankle, and at that point, you will record the passive range of motion of the ankle. The same process is done for plantar flexion, except that the subject is asked to plantar flex their ankle. For ankle inversion and eversion, the subject is sitting with the leg off the table. The tester stabilizes the tibia and the fibula distally. The axis is between the 2 malleoli, and the ankle is in a subtalar neutral position, which is a slight plantar flexion. The stationary arm is parallel to the tibia, and the movable arm is lined up with the second metatarsal. The subject is then asked to actively invert their ankle. The measure is recorded, and the tester will passively take the ankle into further inversion, at which point you record that measurement as well. And the same process is repeated for the eversion range of motion. For knee flexion, the subject is in a supine position with the knee in extension at 0 degrees. The pelvis is stabilized by the weight of the patient's body, as well as the tester will stabilize the femur. The axis is over the lateral epicondyle of the femur. The stationary arm is parallel to the femur pointing towards the greater trochanter, and the movable arm is parallel to the fibula pointing towards the lateral malleolus. You then ask the athlete to actively flex the knee as far as they can go. You will then record that degree and then take them further into flexion passively and record the passive range of motion of knee flexion.